All right, so if you look at yourself in the mirror and your neck is not straight, mine is a little off to the side. If your neck is not straight, if your jaw is not straight, if your head is tilted like this, or in some severe cases, if you look at yourself and you're looking in the mirror at yourself like this, then there is definitely going to be something wrong, not only with your neck, but with your autonomic nervous system because of the cranial nerves. All of the cranial nerves leave the cranium and they run along the cervical spine. So if there's an abnormality in the curvature of your cervical spine, that is going to cause issues with the organs that they innervate. So for example, the vagus nerve, which has two branches that come out the back of the cranium and then they kind of wrap around to the front of the body, and they come out right here, the right and the left. And the right side is more for the gut, the left side is more for the heart. But the right side, it innervates all of your digestive organs, and there's a lower diaphragmatic branch that innervates the reproductive organs and the genitals. So it goes all the way down to the pelvic floor. It is a nerve that they call the wandering nerve because it is all over the body. And that is cranial nerve 10, the vagus nerve. And if you have issues with your spine, that may be creating either poor vagal tone or actual degeneration of the vagus nerve due to a neuron that is damaged in the vagus nerve, or an impingement of the vagus nerve, which is very dangerous. That can cause severe autonomic dysfunction. Some patients who've had their gallbladder removed or had a hysterectomy, they actually sever the vagus nerve because they're removing the organ and it's innervated by the vagus nerve. Those particular patients also have all kinds of issues with their gut, cognitive issues. They may have vertigo, dizziness, ringing in their ears, insomnia, facial pain, issues breathing, issues with their blood pressure and their heart rate, all kinds of issues, all kinds of health problems, autoimmune diseases, because they have severed the vagus nerve when they removed the organ. So it's actually really important to know for certain that the organ has to be removed. So get a few different opinions on that if that is a situation that you are in personally. But back to the posture. A lot of patients have head forward posture, so their head is pitched forward like this, head forward, and a hyperkyphosis of the cervical spine, which is like an S curve, because the natural curve is a lordotic curve, which goes like this. And the reason it goes like that is to keep the cranium stable on the cervical spine. So if that curvature changes and it's now a hyperkyphotic curvature, you might have cranial cervical instability, where the cranium is no longer stable on the cervical spine, and that is a very dangerous issue. I have a lot of patients with this issue, and they have a lot of issues with their parasympathetic nervous system. This could also cause things like anxiety and depression. So if you are going to talk therapy and taking medications for anxiety and depression and nothing is working, take a look at your own posture and think about your daily habits. Are you looking down at the phone all day? Do you have an occupation where you're always looking down at a table or on a computer? Because you may have an abnormal curvature of the spine. And what happens is the space between the vertebrae, it increases, and the ligaments actually hyperextend, and this stretches out the spinal cord. And when the spinal cord is stretched out, your body starts to produce more cerebral spinal fluid. And all of that cerebral spinal fluid in the brain, it's too much fluid, and the brain cannot filter it out. That could actually cause damage to the brain tissue. You could be having migraines, brain fog, memory loss. There are some studies linking it to Alzheimer's disease and multiple sclerosis, all because of issues with the neck. So I do treat all of those issues here with medical acupuncture for structural reintegration. So if you look at yourself in the mirror and things are just all out of alignment, you may really benefit from having a treatment. What I will do is I will stimulate nerve growth hormone in your body to help repair the nerves. It does take time. It's not just one treatment that's going to accomplish this. But I'm also going to work on your neck. I'm going to do some manual therapy to your neck, some stretching, some soft tissue manipulation, some ultrasound massage to heat up the tissue and to loosen everything up. Or I may do some particular needling techniques to strengthen the tendons. If the tendons are too relaxed and hyperextended, you may need myofascial release elsewhere, maybe more along the thoracic spine to help bring everything back, or maybe in the subclavicular area. Maybe you have some trigger points under here too that are tightening the SCM and really bringing everything forward. Maybe your pecs are hypertonic. So I'm going to take a look at everything. There's also a number of other tests I could do to determine whether or not you have poor vagal tone. So I'm going to shine a light in your eyes. I'm going to look at the back of your throat and look at your uvula to see if it is deviated. I'm going to look at the position of the jaw, and I'm going to do a heart rate variability test with an EKG. So I'm going to determine your heart rate variability, and if your heart rate variability is low, you probably have low vagal tone. So if you're interested in finding out more about this and about my practice and what I can do to help, feel free to reach out to me. My website address is www.llhealing.com. We're located in East Setauket, New York. The name of my clinic is L&L Holistic Healing. And I'm here to help, so if you have any questions, feel free to reach out.